name's Noah Adams. This is for the video recorded physical assessment. My subject's going to be my stepdad, Curtis Hawley. He's participating. I'm just going to do a quick view of the room so you can see that there's no notes present. And the only thing at the side of the table is instruments to perform the exam, such as the otoscope, ophthalmoscope, guards, essential oils for the olfactory test, tongue depressor, cotton tip applicators for sharp and dull sensation, deep tendon reflex hammer, gloves, and stethoscope. And we will begin the assessment. Good evening, Mr. Hawley. My name's Noah Adams. I'm a nurse practitioner student. Nice to meet you. What brings you into the office today?
I came in for a physical. It's that time of year, and I'm getting older every day, so it's good to know.
It's good to stay on top of your health. Is there anything that's been bothering you lately? Have you had a cough or indigestion?
Been really healthy.
Good.
Can't complain.
Good. Well, we'll just get right into it,
Okay.
if that's all right with you. We'll talk about your past medical history. Do you
right.
take any medications for any reasons?
Aspirin, baby aspirin recommended for my age.
Okay.
And,
Have you been diagnosed with any health problems?
I had cancer years ago, prostate cancer, had it removed. I've got a clean bill of health now.
Okay, congratulations.
So, yeah.
Do you stay on your follow-up appointments with
Oh,
your
yeah,
primary?
every 6 months I go and
Good.
get a
Good,
blood
good,
test.
good. Do you take any over-the-counter medicine? Any vitamins, minerals, or
I take
supplements?
turmeric, and
Turmeric?
that's it.
Okay, nice
Yep.
and healthy. Congratulations. Let's see here. Have you, other than the prostate surgery for your cancer, have you had any other surgeries?
I had bicep surgery after Hurricane Michael. I was over at my parents' house and
on the left arm.
lifting up a heavy object and just gave it my all, and it tore my bicep loose from my arm and had it reattached.
Oh, sounds
It's
painful.
been 8 months, I think.
Okay. Have you been following up on physical therapy with the
I'm
arm?
good. There was no physical therapy, so just put me on weight restrictions for 6 months, and
Good.
after that I got off.
Did what you're supposed to,
Yep.
right?
Yep.
Ideal patient. Strong
Absolutely.
work. Any other surgeries?
Nope.
Okay, so have your appendix, your tonsils.
Actually, I did in the Coast Guard. My knee. I
You
blew
did?
my knee out and
Which knee?
had my right knee.
Right knee.
But I'm good to go. Just cut some meniscus out. That was
deal.
good.
Good, good. Do you smoke?
I used to 20 years ago,
Okay,
but not anymore.
good job, good
Yep.
job. Do you drink any alcohol?
I do. I like my whiskey. Maybe 4 or 5 drinks a night.
Okay,
That's about it.
all right. Do you use any mixer, or do you normally drink it?
Right now I'm on keto diet, and
Okay, good.
I'm just using Mio for a little flavoring.
All right, so
And-
no additional carbs, just
Yep,
the alcohol.
Yep.
All right.
Lost 46 pounds in the last 4 months.
Oh, congratulations.
Yep.
Strong work.
Yep.
Any exercise you're doing with this, or?
I actually rebuilding my house after the hurricane, so I'm
Yeah.
working every day in my house, and that's a full-time job.
Yeah, I think
Good thing.
everyone's felt that impact in this area.
Good thing I'm retired from the fire department.
Yeah,
I can get
so
to do
retired.
this.
Nice, so you got the time on your hands.
Yep, 28
Good.
years.
Just as long as you don't overdo it and hurt your
Yeah.
bicep again.
Yep.
Good, good. Any illicit substance abuse?
Nope, not at all.
Okay, good, good. Let's talk about your past family history.
All right.
Does your mom have any health problems?
She had heart surgery about 5 years ago, maybe 6. She's 80 years old now.
Okay,
My dad passed away of brain cancer.
I'm sorry.
Grandparents, he was an alcoholic and had liver failure, and
Okay,
cousins all seem to be very healthy.
good, good.
Yep.
How old was your father when he passed?
75, I believe.
75, and it was only brain cancer. Didn't
Yep.
it? Sorry.
Yep.
Okay.
Yep.
All right. Other than that, no other medical history throughout your family. Then
Nope.
sounds like.
Yep.
Good, good. What all? What was your mother's heart surgery? Was it? Did she have a vessel replaced, or was it a valve replacement?
leaking.
Okay, so they replaced the valve.
Yep.
How's she doing?
Great.
Good.
Great.
Glad to hear
It's hard to keep up with her.
it. That's how you do it. Good. Well, I'm glad she's doing all right.
Mhm.
Let's see. We've already talked about your diet. Sounds like everything's going well. I'm just going to ask some simple questions since you don't have any stated complaints. I just want to make sure everything's good. So you haven't had any headaches?
No.
No dizziness?
No.
Any muscle weakness or fatigue?
Just aches and pains from working all day. That's it.
Okay, but no fever or chills or anything like that? No
Very
cough?
healthy. No cough.
Okay, I know the weather changed recently. Have you had any problems with your sinuses or anything like that?
Well, in the mornings from CPAP.
Okay.
Or a CPAP at night. So.
Okay, so you use a CPAP?
Yeah. Nose running in the morning just from the CPAP.
Okay.
That goes away after a couple hours.
Good.
Mm-hmm.
Let's see, no problem urinating, bowel pattern's been normal.
No.
Okay, regular bowel movements.
Yep.
No gas, no belly pains.
No, it's shrinking.
Shrinking?
Yep.
Good. All right. No problems walking. You haven't had any, like I said, no irregular falls or anything like that.
Nope.
Correct?
Nope. I'm doing
Okay.
good.
Good. No complaints at all. From this point on, we'll just do the physical assessment real
All
quick and just head to toe. So what I plan on doing is we'll start at the top of your head, we'll move down, I'll take a look at your different cranial nerves, your head, your skin. I'll check your eyes, we'll just take a look in your ears, up your nose, and in your mouth.
Okay.
Press on your belly a little bit, listen to your lungs and your heart, and just make sure everything's good. Okay?
All right.
Thank you. All right. First, I'll just have you take a quick look at me. Right now we're going to assess his facial nerves. I'm going to have him do a couple facial expressions and make sure he can move his face symmetrically or not. You can raise your eyebrows for me. Okay, no deviation. Can you smile? Good job. Can you open your mouth? Great. I'm just going to feel for your temporal artery right here. Good. Have you had any pain back here at all?
No.
No knots, no nodules. Nice and clear. Hair's thick, skin's intact, no dry splotches. Hair's well groomed. All right. Next, I'm going to check your optic nerve.
Okay.
And I want to see if you can see when I move my hands. So if you can just look straight at me, I'm going to start moving my fingers. Let me know when I start moving, and then we'll transition.
Out of my range, I cannot see. There you go. Right
Okay.
now. Yes.
Okay, great. Next, we're going to check ocular motor, trochlear, and abducens. I want to have you follow my fingers. Okay? Keep your face. Follow my fingers with your eyes and keep
Okay.
your face facing
Yes.
me. Okay. Great. No deviations. Eyes appear symmetrical as well. Next, we're going to take a look into your eyes. We're going to check for pupil dilation. We're going to turn off the lights and keep the lamp on. Let your eyes adjust a little bit. Now, if you'll please just continue looking for it. I'm going to look in this pupil right here. Pupils are equal and responsive rapidly. Now, to save you the issue of me putting light into your eyes longer, the optical fundus exam would be to where I use the ophthalmoscope to look directly into the pupil and take a look at the retina and the back of the eye and check out for vasculature and make sure that's all within normal limits. But to save our volunteer here the abuse of a light to the eye, you all right?
Yep, I'm fine.
Good. All right. Next, I'm going to take a look into your ears, okay?
Okay.
There's going to be a little bit of pressure as I put the guard in, and I'm going to pull on your earlobe up and to the back just a little bit,
All
okay?
right.
Bit of earwax buildup, but everything's good. Tympanic membrane is a nice pearly white and intact. We'll check this other ear. Again, a little bit of pressure. And again, this tympanic membrane no ear pain at all?
No,
No pressure on that right side?
nope.
Good. Alright. It's nice and clear. But again, like I said, got a little bit of souvenirs on the way out.
Oh yeah. I have the issue with earwax.
Alright, next we would actually do a Rhine test, which is a exam of the tympanocochlear nerve. And what I'd do is I'd actually stand 2 feet behind the patient and in a soft voice whisper a combination of 3 either letters or numbers in any combination, and ask the patient to repeat those while blocking the untested ear. If he can repeat the combination to me the first or second attempt, then it's a normal finding. If he's wrong 3 times on that affected ear, it's a abnormal finding on that test, and further referral will be needed. But we're going to skip that too, since we don't have exactly enough space in this exam room. All right. Next, I'm going to assess your neck. So right now, I'm actually going to take a look. If you could tilt your head back. And I did not bring a glass of water to check your thyroid, so just pretend to swallow while I actually check your area for the thyroid nodules. Trachea is nice and midline, no deviations, no nodules or lumps. I'll check behind the ears as well. Neck appears symmetrical, no tenderness when I was pressing,
No.
and no abnormalities.
Nope.
I'm also going to check your mandibular joint as well.
Okay.
You'll open and close. Next, I'm going to check your sinuses as well. So I'm going to apply pressure above your eyebrows and underneath your nose.
Okay.
Any pain?
Nope.
Okay. Any pain at all?
Not at all.
Good. Next, we're going to take a look into your mouth. During this exam, I'm going to ask the patient to say ah. I'm going to see if the uvula is midline. There's no drainage down the back of the throat, irritated skin cells, pustules on the tonsils. When I ask the patient to say ah, the uvula should lift along with the soft palate. This assesses the glossal and vagus nerves. And then I'll ask the patient to stick his tongue out and check for regular motor function of the tongue, which will be assessing the hypoglossal nerve as well. So if you'll say ah,
Ah.
good. Everything raises appropriately.
Ah.
You're good. Looks like you're missing a molar on that left side, and you've got a crown on the right. But other than that, teeth look good. If you can lift your tongue up for me. Good. No lesions in the mouth. Tongue appears bilateral, moves accordingly. Thank you. Next, we're going to check the patency of the nares. This sheath's a little bit bigger than the others, so if it bothers you, let me know. And if I trigger a sneeze, let me know so I'll get out the way fast enough.
All right.
Thank you. All right, sir. If you'll tilt your head back just a little bit, you're going to have some pressure on the outside, then we'll tilt it in. Might tickle a little bit. All right. Turbinates are good, not boggy. Airway is patent. No polyps noticed.
That's good to know.
And next, we're going to check the olfactory nerve with a scent test. Let me know if you smell this. This is just strictly peppermint oil.
Oh yes.
Yes.
Wow. Definitely smell it.
Yeah, this person working on the OR.
Yeah, it works.
All right. So next, we're going to assess the accessory muscles of the neck. This is the accessory nerve, the cranial nerve. If you can just raise your shoulders for me. Good. No deficits. Strength's 5 out of 5. All right. Now we're going to take a look at your back. What I'm going to do Mr. Hawley, is cover you up with this blanket to maintain modesty, and then we're going to undo the buttons on the sleeves of the gown and expose the top portion of your chest, if that's all right,
All right.
sir. Alright, first I'm going to assess your back. I'm going to percuss a few sounds on your back to make sure I can tell if your lung fields are hollow, or if you have consolidation, which would let me think more of a pneumonia or some kind of buildup back there. Also on the lower fields, I'm going to make sure your diaphragm's within normal reason, in the normal area that's supposed to be. I'm also going to feel with the palms of my hand to make sure that there's no differentiation and vibration whenever you speak as well.
All right.
Okay, and then last I'll take a listen to your lungs.
Okay.
Now, probably be easier if I did this.
You want me to just stand up?
Ah,
I don't mind. I'll hold it.
we'll kick it.
Okay. If we weren't on video.
Yeah.
Mhm.
All right. So, what I'd like you to repeat is the word 99. Okay?
Now,
Yes, sir.
99.
Okay.
Again,
Again.
99.
Again.
99. 99.
Good. Take a deep breath for me. Breathe out. All right.
Mm-hmm.
Deep breath. Breathe out. Good job. Other than a few patches of hair, back appears within normal limits. No lesions, no irregular moles noted. No bumps. I do notice you have a scar up here. What was that from?
No idea.
Okay. Next I'm going to percuss you. And what that is again, like I showed you, I'm going to expand my hand and just tap the knuckle. So you'll have a little tap. Doing okay?
Yep.
Alright. Everything sounds good. No sounds consolidated material. Next, I will take a listen to your lungs. If you'll take a deep breath, breathe out, breathe in, breathe out, breathe in, breathe in, breathe out, breathe in, breathe out. Good job. Any pain along your back, sir?
No.
Nothing along the lower back either?
No. Everything's fine.
Okay, good, good. We'll move you around to the front. I'll take a listen to your lungs. Just be careful, lift your feet up. Let me drag you. Great. All right. Comfortable?
Yep.
All right. to your neck. We're going to see if you have any breweries. I wish. Breweries. This lets me know if there's any turbulence in your bloodstream or not.
All right.
Okay. What I'll have you do is take a look towards the computer, take a deep breath and hold it.
Hold it.
Yeah, you gotta hold it.
Sorry.
That's alright. Deep breath and hold it. Okay. Next we're gonna have you look the opposite way. Do it again. 1, 2, 3. Alright, good. Thank you. Just like I held pressure on you before, we're going to do that again. Okay? 99. Say 99.
99.
Say 99.
99. 99.
Okay. Good job. Take a couple deep breaths for me, please. Again. All right. Now I'm going to percuss you as well on the front.
Okay.
Okay? Oops, sorry. Sorry.
It's all right.
Missed. Okay, so nice hollow sounds. Everything sounds good on the upper chest. I'm going to take a listen to your lung sounds on the front again.
All right.
You can take a deep breath. Breathe out. Okay. Everything sounds great, nice and clear. So we're going to move to the abdominal exam next.
Okay.
And we'll check out your upper extremities once we stand up and check the rest of your range of motion out.
Okay.
Actually, we're going to do a cardiac. We're going to listen to your heart next.
Okay.
If you'll go ahead and lay back on the table for me. Are you comfortable?
And now.
A little easier if we had the brakes on instead of you on steer. Okay. So I'm going to take a quick listen to your heart. I'm going to lay down just a little bit. I want you to lean towards your left side when you lay back. So I can listen to your S3 just a little bit. Great. Thank you. Just take my hand and I'll lift you up. Alright, next I'm just going to check your pulses, make sure they're nice and strong. We're going to check your radial pulses first. We'll check the brachial pulses as well. Alright, Pulses are intact bilaterally. Heart sounds are great. S1, S2, and S3 are identified. No bruits noted when I listened to the carotids. And there's no sounds of a murmur or irregularity while listening to the heart sounds. I'm going to lay you back now. We're going to take a look at your tummy.
All right.
All right. Again, skin's within normal limits. No abnormal lesions, moles. Small bit of hair, but it's symmetrical along the abdominal. There we go. We're going to percuss the abdominal area as well. This lets me know. Okay.
Absolutely. It's like hitting a brick wall, isn't
Exactly. There's no give.
it? I don't have a 6-pack. I got a 12-pack.
All right. No pain while I was palpating or anything like
No.
that. Press around.
No.
I want to take a quick listen to your bowel sounds.
All right.
Nice and active. Everything's moving. Almost sounds like I need to treat you to lunch after this.
Mm.
All right. Bowel sounds active in all 4 quadrants. Next, I'm going to palpate several things in your abdomen. Light touch first, and then we're going to go a little bit deeper to see what I can feel.
Okay.
First, we're going to check for your liver, then your spleen, then both kidneys along the back side too, to see if I can palpate those.
Okay.
Any pain with that?
Nope.
Some more feel for orange. Any pain?
Nope.
Any pain?
Nope.
And next, I'm going to palpate and see if I can feel your aorta.
It's a long ways down
That
there.
is a long ways down. All right. What I want you to do is take a deep breath and try to breathe out. We'll do some 1, 2, 3. Okay. Strong. Okay. Good. Good. Thank you. No pain.
No pain.
Good.
4 months ago, you probably wouldn't have been able to reach it.
No, no, you have lost quite a bit of weight, sir. All right. Next, we're going to cover up the front. We're going to keep moving our way down.
I need to sit up.
We'll set you up.
All right.
Unbutton the sleeves.
Mm-hmm.
down just for 1 second so I can check out your
All right.
legs. We gotta check your groin out as well, so you can keep the underbrow. So just lay back down. Actually, there you go. You all right?
I'm fine.
It's not bothering your back?
Nope.
Okay. First, I'm gonna feel your lymph nodes in your groin. Sorry.
Ticklish. I don't know. You
You
may
all right?
not be able to do this. You
Okay.
may have to explain that one.
Okay. So the lymph nodes run right there along in the groin area. If there's were any indication of infection, those lymph nodes would be swollen. Runs real close to the groin, and some people are a little bit more sensitive in that area than others.
Right. Super ticklish.
Sorry. So
If
we'll
it was
work on that.
inflamed, it would hurt, and then that'd be easier, I guess.
Sorry, Curtis.
It's all right. Sorry for you, but
Yeah, I appreciate you volunteering for this. Okay, first, I'm going to check your pulses in your lower extremities. Strong dorsal pop too. Strong pulses throughout. No hair loss on the lower extremities. You haven't noticed any swelling down on your lower extremities either,
it
correct?
used to be when I weighed a lot more. I would have definitely an indentation where my socks were from
Okay.
compression.
But not anymore?
Not anymore.
Great. All right. Now, if you can raise your leg up, what I'm going to have you do is we're going to check and see how strong your muscles are. So first, this one's, I'm going to help just suspend it. All right. Try to raise your foot up for me. Off the bed. Off the bed. Good. Good. Now we're going to do it on the other leg. Raise the foot up. Good. Next, I'm going to have you put your heel down into the bed and try not to have me pull it up, okay?
Mm-hmm.
Okay, good. Same with the other. Good. Next, I'm going to have you straighten your leg out. And we're going to check your ankle. Push down against me. And then raise up. Good. Push down. Raise up. Great. Great. Next, we're going to check for a Babinski. And this, normally the toes fan away. If there is any kind of brain damage, normally it'll curl too. Now in babies, it's the opposite in the newborns because everything's developing. But you, sir, should go towards the stimulation.
Okay.
Okay. You see how your toes drew in, so we're positive sign. Same there as well. Thank you. All right. Toenails look good. No sign of fungus infection or anything like that. All right. Now we're going to set you up and we'll start working on range of motion, musculoskeletal. Actually, let's do your sensory, the dull and the sharp, since I got you laying down.
Yep.
So what I want you to do, are you sure you're comfortable like that? You want me to get you another
I'm
pillow
fine.
or you can hold?
I'm fine.
Okay. Just hold your arms straight down with your palms open. Okay.
Didn't do this.
Yeah.
There we go.
You want me to roll it up?
I'm fine.
Okay. All right. And just close your eyes. I'm going to touch either your arm, legs, or face, and you tell me if it's sharp or dull. Okay?
I would say sharp.
Sharp. This is sharp.
Okay.
This is dull.
Okay.
Okay.
This right here, the nerves are bad, so
From the surgery?
from the surgery.
Okay. Good to know.
Soft, dull, dull, dull.
That's sharp.
Was
I
it?
need a new instrument. Normally,
Put a point on it. Pencil sharpener.
let me go get a needle for you, Kurt. Sorry, I need to keep this professional. Okay.
Uh,
This is sharp. Can you feel that?
yes.
This is dull.
Okay.
Okay.
That is sharp. That's dull.
Okay. Also, tell me where I'm touching.
Arm. Right arm dull. Face dull. Right arm. Push a little harder. I'm going to say dull. Dull. Face.
I'm not gonna show the face.
That's sharp.
Okay.
Arm.
Good.
Dull. Foot. Push harder. Dull. Arm. Hand. That is sharp foot.
Sorry.
No, it's fine. That's dull hand.
Okay. Good. Thank you. Alright. I'm gonna have you sit up. We're gonna check a few more things. Range of motion first. Okay. Just for this patient's past medical history, since he had the bicep repair on the left side, we're going to review. We're going to forego the deep tendon reflex on the bicep and the tricep on that side, just so I don't aggravate that arm. All right, sir. If you can lean your arm forward. Now try to not let me pull it away from you. Okay, good. Now push against me. Good. Now hold your hand. Fist. We're going to tilt it back. Good. No pain with that?
No.
Okay, now we're going to do a similar on both these. Pull them in, push away. Any pain with that?
No.
Okay, good. Next, I'm going to have you hold your hands open. Squeeze my fingers. Grips nice and strong. No decrease. Strength still 5 out of 5 on the upper extremities. If you'll hold your hands wide open. Okay, good. Try to hold the fingers open. Don't let me push. Good. Great, great. Now what I'm going to have you do is hold your eyes. Hold your hands out. Close your eyes. And hold your feet off the ground. What I'm going to do is either push up or down on one of the digits. You let me know if it's a toe or a finger, and if it's up or down, okay?
Okay. Up finger. Down toe. Up finger. Up toe. Down toe. Up finger. Down finger.
Okay, good. Thank you. That's good. Next, we're going to see range of motion on the lower extremities, range of motion on the upper. I'm sorry, sir, just going down the checklist. We'll check your range of motion and your gait next. So if you'll stand up and put your back to the lamp. Is your gown tied up? We're not going to move the camera. Okay. If you will please walk heel to toe towards there. Towards the wall. Thank you. And now, good job. Now if you can hop on one foot for me. On the other foot. No weakness in either extremity. Next, I'm going to have you stand still and close your eyes. Just going to see how you do for a minute. I'm going to check your Rombergs, and that's where you're actually going to hold up with your palms facing up. Keep your eyes closed as well. What this does is it lets me check your proprioception. Make sure your nervous system understands where your balance is, whether you see it or not. What we're going to do is tap. Okay. Good job. If you have a seat for me, we're going to check a few other neurological symptoms as well.
Okay.
What I'd like you to do is run your heel down the shin of the opposite leg and then do it with the other. Good job. Next, I want you to take your index finger and touch that first joint and see how fast you can tap it. Good. Now do it with the other hand, please. Good job. Next, I want you to reach out with your right hand, touch your index finger to my finger, and then touch your nose. Do it again.
That's fun.
And do it with the other hand now, please.
This is the first time I've ever done this.
Good job. All right. Neurologically, all nerves are intact. Patient's able to follow commands appropriately. Patient's alert and oriented to self. What day is it?
Today is Saturday.
Good. Well, who's the president?
I don't know.
You don't know?
No.
Okay, let's go take you to triage. Who's the president?
Trump.
Good job. All right. Alert to self, place and time. Let's go. Well, you can check your back now. I'm going to need you to stand up and touch your toes. And we'll check the how well your spine moves. Good job. Now, if you can just lean forward for me again, I'm going to make sure the alignment of your hips are appropriate. As far as you can without hurting yourself. Good job. All right. Now lean back as far as you can. Good. Now try to lean to the side. Good job. Good job. No decreased range of movement on any upper extremities, back or legs. You can sit back down for me. Grip strength strong. I really can't think of anything else. Let's discuss what the health plan is. We can go over a little bit of education.
Okay.
I haven't taken your vital signs yet, so let's see what your blood pressure is and what your pulse ox is. You want me to take it on that? Have you got any
Fine.
problems? Okay.
I actually just had a physical yesterday at the VA. And I took it on there.
Okay. The left side's normally where we like to go unless there's any reason not to. This thermometer actually checks the temperature of your temporal artery. So what I want to do is go across the forehead and then tap right behind the ear.
Okay.
98.1 on the temperature. Pulse rate is 61. Oxygen levels at 98%. And blood pressure is 128/81. Looking good.
Wow.
And can you tell me what your height and weight is, sir?
I am 252 pounds and I'm 6'3". I squeezed it on, sorry.
That's all right. Just trying to save me from having to have it pulled off.
Yeah, it don't matter.
One thing we have not not tested yet is your deep tendon reflexes.
All right.
So we'll test your bicep reflex first. You feel that little jerk you have?
Mm-hmm.
May not be in that order. Okay, good. Reflex is positive. Do I need to raise the bed up at all?
I'm good.
Dang.
It used to be shaped like a tomahawk. Now they just got little round nubs.
This one, this is what the best EOR has to offer. But yes, they are still shaped like tomahawks.
Oh, okay. I thought this was new and improved.
No, no.
Ooh, that was a good one.
Sorry.
That's fine.
I'm not trying to get you too hard. Okay, so deep tendon reflexes are intact. +2. All right. Overall, you sound good. You look good. There's no decrease in strength anywhere whatsoever. No decrease in range of motion. You're already working on your weight. I could talk to you about diet, but you already got that licked.
Yep.
The only thing that's borderline is your blood pressure. New guidelines recommend 130 over 80.
Uh-huh.
With the 128, you just need to keep an eye on it, but you're probably still a little low. What do you know where you normally ran?
Yesterday it was at 110 over 80, so.
So it could be that. It could
I
be
don't
the
know.
fact that I've got you in here on video.
It could be.
So just keep an eye on it.
All right.
Other than that, everything looks good. Mr.
All right.
Holly, I appreciate you coming
Thanks,
in here.
Doc. I appreciate it.
And just follow up as you need.
All right.
Thank you.
All right.